Hey, this is Connor with Conquest HP, and today I'm going to ask you to be very careful with your chiropractor, your manual osteopath, your physiotherapist, your massage therapist, anyone that is dispensing some kind of health related service or care to you. Be very careful listening to what they say and be very careful accepting what they say and what implications those words carry for you. You have to be careful with this and think critically about it because we're talking about your health. And when we're talking in particular about you feeling some kind of pain or symptoms or how you view your own health or your own ability, you can be swayed very easily by what other people tell you. And if you're swayed in just the right way, what it might end up meaning is perpetuating symptoms that you are already experiencing, maybe worsening those symptoms. And this is surprisingly common. But as a therapist, I can say that many therapists are not trained on how to talk about pain and how to talk about symptoms and the right verbiage and language to use with patients to make sure that we're pushing them or pulling them rather in the right direction instead of perpetuating that issue. And I'm talking about this because I have a client that recently went in for some therapy, and I'll leave the discipline out of it because that's not the point. They recently went in for some therapy because they had a little back pain, low back pain. They went into the office saying, I have mild back pain. It's coming up when I'm doing this sport that I like to do. They left the office with 6 other reasons for them to have that back pain. The complaint was simple. The complaint was, I have back pain. The back pain is coming up with this activity that I like to do. I'd like to keep doing it. What can we do? And it turned into, your foot is wrong in this way, and your knee is doing the wrong thing here, and it has inflammation, and that's going to be a problem. And your hip is broken in this way, and your low back is dysfunctional in this way, and you're crooked here. A laundry list of things that are wrong with this person now, wrong with the person. A list of reasons to keep the pain alive, to keep it going. A list of reasons to perpetuate that issue. They didn't go into the office with any of those reasons. None of those reasons had to come up. Does inflammation in your knee necessarily mean that you're going to have back pain? No, it doesn't. It doesn't have to be related at all. Maybe in some cases it is related. Maybe there is a correlation between the two. But you can't say as a therapist, this is wrong, and that's the reason that you have pain here, because it's almost always more complex than that. And for me to say that is to put that idea in your head. And the problem being that if you came in with a simple case of back pain, I have now taken away your control over that issue. I've said, this is wrong, that's broken, this is crooked, etc., this is inflamed. Maybe I've given you a couple exercises or strategies to work on it. But you now have to rely on me to help you solve that problem. You need to help, I need to help you fix that crooked hip or realign that vertebrae or whatever it might have been, whatever the justification was. You need me now to help with your pain. You see how the system's broken? You came in with a simple complaint. You left with things that you can't fix on your own, that I have to fix for you, that'll perpetuate the pain from now on. Now, if that's the best option, maybe we can argue for it, but that is not the best option. In the case of someone having back pain, low back pain is incredibly common. I know as a therapist, if I give that person a reason to keep going with that pain, to keep feeling that pain, it's not going to make it any easier for them. It's very important for me as a therapist to reassure the opposite, that it's okay that the pain is there. You have to accept that there is pain there. That's fine. Let's start with that. And then let's work on restoring some kind of function through this pain. You know, we don't necessarily want to recreate pain, but if you come in and say, you know, I can no longer do this sport, or I can no longer sit this way without pain. Okay, this is great. We have a very specific starting point. My goal as a therapist is to resume or to return that function to you, is to get you to be able to do that thing again without pain. You know, the complaint that you have, the thing that is causing pain, or the thing that pain is coming up while you're doing it. My goal is to get you to be able to do that without pain, or at least to be able to get you to be able to do it on your own again. It's not to give you a whole bunch of reasons that you have pain. You know, I don't want to put you in the diagnosis box. So if instead you come in with some back pain, and sure, we can get MRIs and x-rays and stuff like that, because, you know, we all know that those are invaluable. This is sarcasm, being really sarcastic. But what if instead I broke down the movement that you're experiencing that pain in, or the position that you're experiencing that pain in, and we pulled things back, and we try to get you to have a little bit more control over those positions. Maybe we scale it back to a couple like simple core positional stability exercises. Maybe you've got a mobility issue we can work on, and we can clear that up, and then slowly expose you to that position again. You know, if I do this instead of labeling you and saying you have pain because of these things, then I can say, look, you can do this regressed version of what you were doing. You can't squat to full depth yet, right? You can't go all the way down to 90, but you can get halfway. And all of a sudden you have this sense of control over your own issue. You can see, I couldn't do this before. Now I can do this. I feel like I'm empowered to fix my own body. I feel like my body can still do things. I feel like there's less of a reason for me to experience pain. The way that we as therapists present the problem back to you is incredibly important. And if you are one of the bazillion people that are receiving treatment from someone who you feel maybe is not using the right language, or maybe doing something that's kind of perpetuating that issue for you, I strongly urge you to question what they are doing, and question them directly to their face. Ask them what the purpose is. Ask them what the long-term goal is, what the strategy is. Try to figure out what they're doing, because this happens incredibly commonly. And there's nothing good about taking away the power from the patient and saying that all the power is with me as a therapist and I'm going to fix you. There's nothing good about that. That is a stupid system, and we should not be doing anything to support it moving forward. So, rant over. If you have questions or comments, definitely leave those below. I'm more than happy to talk about any of this. And let me just add a PS that the only reason that I'm well aware and painfully aware of these issues is because I committed many of these errors on my own, in my own practice in the past, because that's just the training that I received. I didn't at the time have the same grasp of pain science the way that I do now. So I understand if you're a practitioner or a therapist and you're committing those same errors. I have absolutely been there. There's no reason to take this personal. Just use it to get better. You know, absolutely, objectively evaluate what you're doing. Put the patient first. It's an easy decision. So definitely leave me some questions, comments below. If you liked the video, hit the like button, subscribe, all that good stuff, and I'll talk to you guys again soon.